Okay, so I'm sitting here with John Moore, where you are in St. Charles, Missouri, and just wanted to ask a couple questions. So, John, what would you say you were experiencing in the past before we met and before you came into the office?
Sure. So I've had some chronic, ongoing problems with my spine, probably due to playing a lot of contact sports when I was young, and then getting into a couple of motorcycle accidents a little bit later in life. I've been going to general chiropractors for years and pretty much experienced the same thing. They would come in, tell me we know what's wrong with you, put me on the table, pop my back, and then I'd have to go back and see him in a week or 2 weeks because the pain would slowly creep back in. I met you. Actually, we were playing lacrosse together one day, and you indicated that you do things a little bit differently, so I was intrigued by that because having the same pain come back all the time just wasn't working for me. Said you had a different approach, and sure enough, we did a bunch of x-rays. You kind of diagnosed what was going on, saw some structural issues and how my spine was working, went after some very specific things. And at first, I have to be honest with you, I was a little skeptical, but results, quite frankly, blew me away. Initially, the first thing I noticed is that, after 2-3 weeks, my back wasn't hurting. Still continued with, working with you to make it even better and better, but the chronic pain, it was almost an expected pain to be back in 2 to 3 days, and it wasn't there anymore. So that was certainly refreshing. But the things that really I found interesting is when I'd go out and play lacrosse, I felt I was getting old, which really I can't turn that back. I am getting old. But I discovered quickly that my endurance was better on the lacrosse field. I could run better. And I think ultimately what it comes down to is through your approach of kind of lining up your spine and effectively setting your body up to work the way it was intended to work, that over time, just your ability to perform, your ability to do things just get better and better. And I've noticed that. I don't know how long I've been coming out here. Is it on a year yet? But I'm to the point now where I participate in full contact lacrosse, and I'm in my 50s. Recently won a state basketball championship over in Illinois with a bunch of older guys in the senior games, and quite frankly, these are things I wouldn't have even really thought about. But feeling my oats, I guess is one way to put it.
Nice.
So it's working really well.
Good. I'd love to hear that. So it's worked for you on the field that you've seen. Is there any other things that you may be able to notice at this point? We look at things, not just how you feel as far as pain, but maybe other ways, just how you feel in your thinking, and as far as your sleep, as far as digestion, as far as just day to day.
Yeah, I mean, I noticed that I don't get upset stomachs as much as I used to. It was funny when you're a young kid. I grew up in a part of the country where you eat lots of spicy foods. So that's kind of part of my normal day-to-day is indulging in Mexican food and things like that. And there was a while that I kind of steer away from it. Now that you mention it, I don't even have to worry about that anymore. We go down to Cherokee Street, go to the various different restaurants.
Yeah.
Can enjoy the foods I liked. It doesn't really bother me that much. Sleep used to be interesting in that I'd toss and turn a lot because I was uncomfortable. And about 2 hours, I'd wake up, have to change positions, and it doesn't happen every night, but more often than not, I'll sleep a good, solid 6-7 hours without needing to move around and stuff. So, yeah, there have been other things rather than feeling good that this has helped. Now, am I thinking clearer? I don't know. You probably need to ask my wife about that one.
Okay.
But overall, yeah, this has been something that has helped me immensely,
Awesome.
which is why I'm still here and I'm chatting to you today.
Awesome, and I really appreciate it.
Yeah, not at all.
Probably the last thing I would say is there anything that you might want to say to someone who may watch this? Because the goal behind doing this is to hopefully have someone watch it who may be having trouble, health problems, could be something similar to you, maybe what you were going through. Is there anything you might want to say to anybody who watches this?
I know there's a lot of stigma in society about chiropractic care in general. And for some reason, specifically in North America, we put a lot of credence in the medical profession that, if you go to a doctor that can prescribe drugs, that, everything's going to be taken care of through application of drugs, physical therapy, and things like that. And it's not true. I went through multiple doctors. I've been prescribed the muscle relaxants. I've had physical therapy. to work on various different things that ail me. And although I'm not necessarily saying that those things can't help people, I think you have to be pretty narrow-minded not to realize that, you know, if your axle's broken on your car, you just go ahead and put different gas in it. I mean, to me, that doesn't make any sense. You need to go to someone who's a mechanic, and not meaning to diminish what you do as a mechanic, but you look at physically how we're put together, find things that aren't the way they're supposed to be, get it lined up to allow the body to heal itself. And unfortunately, not all chiropractors are the same. It's just like anything else. There's some good doctors, some bad doctors, and I'm not here to disparage, you know, anyone else I've seen in the past. But I will say that you have some rare talents, and I appreciate. I'm really thankful I met you, because you've improved my quality of life immensely. So thank you, sir.
You're very welcome.
All right.
Thank you for doing this today. Hopefully we'll get to help some more people with it. Thank you.
Sounds good.
Take care.